More news coming in regard to the HMPV, the Human Metapneumovirus. Now, 5 cases have been reported in the country. We're talking about 2 cases that have come out of Karnataka, 1 in Gujarat and 2 in the state of Tamil Nadu. The virus is believed to have originated in China, has raised alarms worldwide due to its resemblance to the early days of the COVID-19 pandemic. The government, however, has gone on to say that, there is a high alert as far as Beijing reports, as far as that surge in respiratory infection is concerned, leading to overcrowded hospitals and strained healthcare systems. However, the government here, the health ministry, has said that there's no cause for alarm, no cause to panic. Health experts have clarified that this is really not a new virus. It's been around. It was first identified in 2001. It has been circulating in the entire world for many years. HMPV spreads through air by way of respiration. This can affect people of all age groups, which is why we're seeing the cases as young as 3 months old, and the children who are being reported as far as those cases are concerned, and they've had no travel history whatsoever. So the health systems and the surveillance networks of the country are vigilant. There's no reason to panic or worry, is what JP Nadda has gone on to say. However, the number of testing, as far as expanding, there's a plan by the ministry to expand the number of labs testing for this virus, the HMPV cases, and task the Indian Council of Medical Research, the ICMR, with a year-round monitoring as far as trends are concerned. And Delhi and Maharashtra in particular have issued guidelines and precautionary measures.
On recent reports, the cases of HMPV in China, the Health Ministry, the Indian Council for Medical Research, and the National Center for Disease Control are keeping a close watch on the situation in China as well as in the neighboring countries. No surge in any of the common respiratory viral pathogens is observed in India. Joint Monitoring Group meeting was held under the chairmanship of Director General for Health Services on 4th of January 2025 to review the situation. The health systems and surveillance networks of the country remain vigilant, ensuring the country is ready to respond promptly to any emerging health challenges. There is no reason to worry.
The global spotlight is on the HMPV virus, which is essentially called the Human Metapneumovirus. Although in India, 2 cases have been found, but those 2 children are recovering as soon as possible. And to get more insight on this virus particularly, I am joined by the former Director General of ICMR, Indian Council of Medical Research, N.K. Ganguly. Sir, please tell us, we know for a fact that this is not a new phenomena. When was the first outbreak of this particular virus?
Actually, this virus is not new, relatively new, that it was discovered in 2001. And since then it is being detected routinely in Indian surveillance system, and there is a 4 to 12% prevalence. 12% was seen in Vellore surveillance, and 4% was seen in the Manipal. And recently there has been an outbreak in Pondicherry, where they had around 1,000 cases where it was identified as 9.7% prevalence.
Any one particular region which is more susceptible in developing this virus?
At this given moment, the virology center which are there, like NIV in Maharashtra, the Jipmar, the Manipal, Vellore, etc., who are good virology labs, they are reporting it through the routine surveillance system. And there are about 3% asymptomatic subjects also, those who harbor it and they don't express it. This is found during December, January, that is the peak season for most of the northern India. The northeastern, northwestern is a little different. There it is found in the March and April. The incubation period is only 4 to 5%, and most affected are children below 1 year. Recently in Karnataka, 2 cases of children have been, both of them are few months old, 3 months old or 8 months old. And the other susceptible age band is 5 to 9 years. And what they have is the symptoms are like influenza or mild COVID. There is a running nose, there is a fever, there is a body ache and malaise.
साल 2020 में आए कोरोना महामारी के 5 साल बाद एक बार फिर से एक नया वायरस HMPV अब दुनिया को टेंशन दे रहा है। चीन और मलेशिया के बाद कई देश अब भारत में भी इसके केसेस आने लगे हैं और इससे क्या खतरा है, इसे क्या ये एक और वैश्विक महामारी का रूप ले सकती है, ये जानने के लिए हम एक महामारी रोग विशेषज्ञ जो हैं डॉक्टर सुनीला गर्ग उनके पास आए हैं। मैम, HMPV वायरस जो है अब केसेस अब इंडिया में भी सामने आने लगे हैं। आप आम भाषा में अगर बता पाएँ तो क्या ये HMPV वायरस क्या है, क्या ये कोरोना जैसा ही है?
देखिए, इट इज़ ह्यूमन मेटान्यूमोवायरस। दैट मीन्स कि न्यूमो वर्ड जहाँ आ जाता है तो समथिंग रिलेटेड टू निमोनिया जैसे। निमोनिया का मतलब है रेस्पिरेटरी ट्रैक्ट को अफेक्ट करेगा। तो करीबन ज़्यादातर ये देखा गया, आपने कोविड के टाइम में देखा होगा, हम परेशान थे कि वो एल्डरलीज को यानी कि बुज़ुर्गों को इफ़ेक्ट करता है, उसके बाद में जो कोमॉर्बिड लोग हैं उनको अफेक्ट करता है। परंतु जो ये वायरस है, अगर हम HMPV की बात करें तो HMPV वायरस की बात अगर करते हैं तो बेसिकली ये वायरस इन्फेंट्स को भी अफेक्ट करता है। इन्फेंट्स मतलब बच्चे जो कि 12 महीने से छोटे हैं, और उनमें से भी कौन से जो कि प्री टर्म बेबीज़ होते हैं, यानी कि फुल टर्म होने से पहले जिनकी डिलीवरी हो जाती है, लो बर्थ वेट बेबीज़ होते हैं, या उनको कोई और सिम्टम होता है, बेसिकली मेल नरिश बेबीज़ हैं तो उनको होता है, प्लस बुज़ुर्गों को तो होता ही होता है अलॉन्ग विथ कोमॉर्बिड कंडीशंस। सांस जल्दी जल्दी चलना, पसलियाँ चलना, बुखार आना, तो ये सारे सिम्टम्स जो आपके कोविड के समय थे, और सीवियर केसेस में निमोनिया, उसमें पसलियाँ चलती हैं, और बच्चों में पर्टिकुलरली निमोनिया इज़ वेरी डेंजरस ऑल्सो।
इसके लक्षण आप कह रहे हैं कि कोविड जैसा ही है?
कोविड जैसा ही है करके, परंतु जैसे मैंने कि बताया कि कोविड वाज मच मोर सिवियर एज कंपेयर टू दिस वायरस।
Tanushka joining us. Tanushka, of course, we heard JP Nadda and also the doctors saying that this is a virus that has been around for a while. It's been doing the rounds since 2001 and there's really no need to panic.
Right, exactly, Divya. What we are understanding about the HMPV virus at this point is that it has been in circulation for the past 20 years in our country. The first case was detected back in 2001. What we have heard, not just from the ICMR, but also from the Ministry of Health, is that there's no need to panic with respect to the HMPV virus. It has been in circulation. There is a robust surveillance system also that is not just tracking the cases that are coming up right now, but also, the past cases as well, so as to understand the nature of the virus as well. This is, just like any other severe acute respiratory illness, and it does fall into the SARI category as well as the ILI category, which is the influenza-like illnesses. What we also know about this disease is that the recent cases that have come up are in infants, a 3-month-old in Bengaluru, as well as another 8-month-old. Out of them has already been discharged. What we also know about this is that last year AIIMS Delhi had conducted a study on 700 patients, out of which 4.6% cases came around with detection of the HMPV virus, and almost 100% human adults already have the specific antigen antibody required to fight the HMPV virus within their bodies already. Because it is, like any other influenza disease at this point, and there are measures that have been not just put out by the center, but also the Delhi government as well, to combat and tackle with any sort of surge situation, which is unlikely at this point, but future preparedness with respect to the virus.